Welcome to the Healing My Parts podcast, a podcast dedicated to educating and raising awareness about dissociative identity disorder, also known as DID. We are your hosts, the system behind Healing My Parts, which also includes parts that function as a therapist and leader in a mental health niche space. We'll be sharing tips and tools that have helped us and many others, while also sharing insights from our own journey of living with the condition. We'll also be hosting guests for conversations to help educate, dispel myths, and most especially help those living with dissociative identities and professionals who treat the condition. Thank you so much for tuning in. And now, let's get healing. Welcome, everyone. Today, I have the absolute honor of sitting down with someone whose work, presence, and passion speak directly to the heart of this community, Katie Keech. Katie is a queer, neurodivergent, and plural therapist who brings brilliance, depth, and lived experience into everything they touch. If you've ever wondered what system-affirming care actually looks like, or what it means to build therapeutic relationships from the inside out, Katie is definitely someone you want in your orbit. In today's conversation, we're not sticking to a script. We are following the threads that light them up. So we'll explore what they most want plurals to know, what they wish more clinicians understood, and the healing possibilities that emerge when we stop trying to fit into other people's boxes. So, Katie, welcome. I'm so glad you're here.
Thanks. That's a really lovely intro. It's almost it's nice to hear such kind words. Thank you. I'm not entirely sure. I know some people know that I am a nun with the Sisters of Perpetual Indulgence, and I've done that work with queer advocacy and queer ministry since 2014. And then I also really focus with my clinical work on just complexity and nuance. And that's, I think, why I got really interested in neurodivergence, because I noticed a lot of times in mental health, and sometimes in the even DID field, like people kind of get into a lane and then don't check things outside of that lane and don't see how things might start to overlap and intersect and bounce off of each other. That's why I started to get into neurocomplexity, because when you have more than one thing going on, it isn't just that each thing shapes your lens, they combine to make a unique way to experience the world. And that there's a disability term that's also a feminist term that I use called Bodymind. I like it better than just like your brain or your psyche, because it's the whole neural network, is the whole body, not just the brain.
I love that.
Yeah.
It's so much more humanistic too.
Yeah.
There's something about, like, I don't know, brain, mind, body seems a little sciencey, but like body mind connection feels really all encompassing.
Yeah, I was surprised to not see it in somatic therapies more than I haven't seen it, but it seems like it would be really fitting for somatic therapy modalities.
Yeah.
I see it mostly in the disabilities and the neuroqueer fields. So, yeah.
For somebody who is trying, I know you just explained it a little bit, but for somebody who's looking for care that really encompasses body mind, how would you advise them to, like, what would they look for? How would they know that they're headed in the right direction if they're reading bios or searching?
Yeah. Well, you would want somebody who has some sort of background or studying in neuroaffirmative clinical work. So that's not just people who understand autism or people who understand ADHD, but because sometimes those studies can be really rigid and want to make people move from being looking autistic to not looking autistic, right? Or looking ADHD to not, like, and that causes a lot of damage. And so more fields where you allow people to be how you are in the world and move how you would naturally be in the world, because then you have less breakdowns and burnouts and exhaustion. So if you have somebody who's paying attention to those things and knows about those things and can be affirmative, which I think also ties into DID as well, right?
Yeah.
Like, because we do a lot of masking and we do a lot of hiding and we do a lot of like blending to look singlet, because and then therapists sometimes expect us to, or that's like the treatment model sometimes, right? Like, how can you look more singlet? That's the sign of health, rather than like, have you resolved your trauma while still looking rather plural?
Right. Wow.
So respect, it's so that respect, yeah.
That's actually so true. that
Yeah.
there is almost this focus on how do you appear to other people rather than what is your internal process and how do you feel and how are you moving through the world and is it okay for you?
Right. Like how do your parts navigate and collaborate? And I know that there are like treatments and focuses that are on that, but a lot of the models do seem to focus on how can we fuse, how can we blend, how can you be the most adult self all the time that doesn't look switchy to people because that looks weird. And if it's weird, then you're ill, you know, it's that top-down thing.
Oh, yeah. I'm curious what your thoughts are. What do you think people are most afraid of if they were to just allow people to present as their authentic selves, which might be multiple parts. It might be having, if you're autistic, having overt stims that are obvious to other people. Like, what do you think people are afraid of about that?
Yeah. Well, I think it boils down to, I mean, we're seeing it with this, you know, administration, right? Not to be, but it also happened with, you know, the Nazi Party in Germany. The first people who got targeted were kids with disabilities, and in specific kids who are autistic. And they were studying kids who are autistic and then exterminated many of them to practice what it would be
Oh,
like to do that. And sorry, I should probably do it, but that was the first round. Yeah. I don't, you know, like we look at, you know, white supremacy and that whole concept of the Aryan race. Like you want sameness, you want predictability, you want a man who looks like this with the man roles, a woman who looks like this with the woman roles. They're straight. There's no gender deviance. There's no neural deviance. There's no way that a person looks or fits or feels different because that's abhorrent. So it's kind of eugenicsy in that way. And we're seeing that again with like Let's Cure Autism. I think it's about rigidity and boxes and white supremacy and all of that boils like down to fascism. Um, Difference is scary because difference is creative and difference is not controllable. That's unacceptable for these people. So when you're accepting like that brains can work differently and present differently and people will show up differently and we can accommodate that and the different ways that there's a really good term that Nick Walker coined called neurocosmopolitanism, which is all of our different minds show up on maybe you know somewhat unmasked or in our bodies and that we impact each other in positive ways and we don't like merge but we shape each other's psychology by showing up with our difference and that makes a more creative and unique culture. I think I just kind of rambled a bit but
no, not at all. I actually, I'm sitting here, part of me is sitting here going, why in the world are there people that want things to be exactly the same versus the richness that happens when we all come together with our differences and our creativity and our just dreams and passions and allowing those to thrive? It's so hard for me to wrap my brain around people that want to squash that.
yeah, yeah, yeah. But I mean you look at like Peter Thiel and he had this vision of like squashing gay pride with all the rainbows and replacing it with like the gray pride and then everybody would be
My
gray and they'd have a gray
gosh.
flag and like literally
Wow.
and
I
right.
have no words. Like, I know some people will say, oh, I think people are just afraid of what they don't understand. But people also don't seem to try to understand.
I think it scares them, right? Like differences scare some people like and the fact that we're plural, right? There's so many people that there are even hate groups designed to dox and
Yeah,
you know attack us for merely existing. Seems so fascinated to figure out who's fake and who's not. Like they care more about it than and we do
that's true.
and spend more time on it. And like I think it scares them. I think, I mean, I know the concept and I know it's been talked about that the concept of trauma and how bad trauma can be scares people. And I do think that's true. But I think more than that, the concept of the complicatedness of consciousness scares people. I think the concept that maybe they might not have a single self themselves,
Yeah.
that consciousness might not be a neat package where you have just one soul and one body and one, is terrifying. Because then if you really think about it, like, then who are you and how can you predict yourself and what does that mean?
People could just let go of the need for predictability. I feel like I get it to some degree, especially if you're a trauma survivor, right? Like predictability feels safer than not knowing what's going to happen every second, which is your life when you're trying to survive. So like I understand like that's
Right.
almost cellular level triggering or reactivity, but oh, when you lean into it, like the magic that can happen when you start exploring the different aspects and parts of the self and what their unique
Yeah,
talents are and what they can bring to your internal table is really exciting.
sure. And you're talking about like in a context when you have your different selves and you've got like good collaboration and people are kind of passing things back and forth. Yeah.
I am not paying attention to what can be the really scarier aspects of your internal world with your trauma histories that you don't know yet, right? You don't know who those parts are, what they do, or they're dangerous. Um, Sometimes by accident,
Hmm.
sometimes by design, right? Like I understand that fear for sure.
But yeah, I mean, that's the lack of control of like knowing what you're going to do and what it's going to happen. And it can cause actual, problems. Not that selves mean to, but
Well, now I've got a bunch of questions since I accidentally dipped into that area. Do you believe that by default, all parts are actually inherently good or
think that's complex because then we get into the binary of what is good
fair?
and what is not. I mean, of course, but because not, I mean, we're all kind of a mishmash, but I do believe that there's something akin to evil, right? Like that, like I aligned more to
Yeah.
fascism. Like if you're going to conceptualize a concept of an antichrist, I would say that is fascism. But I do think most of us, we don't have that kind
Yeah.
of draw. We might have selves that got pushed towards that because of survival and mirroring, of course, people on the outside who were really embodying that and trying to figure out how to placate them so they wouldn't hurt
Yeah.
the body more, right? Or sometimes intentional, right? There's some intentional, but usually, I mean, I don't know about you, but when I work with systems who have intentional, like sometimes I call them groomed systems because I feel like that's better than, I don't know, it's just I almost
That makes sense.
always I get when they're doing things that hurt either people inside or have had hurt people outside, or sometimes if they're stuck in situations where they're currently hurting people, possibly there's always like a story where they got really, really badly hurt,
Mm.
and it's usually pretty brutal, and it's usually not just one time. And once you get to that story, what happened, it's not instantaneous, but sometimes it is. Like the sadness pops in, and that's connection.
Yeah.
And some of that mask of monstrosity drops, and they're not wanting to do it, but they don't know how to get out of it. It's heartbreaking, honestly.
I think that is so important, especially for the clinicians that are listening to know, because it can be so easy to kind of pigeonhole those parts into that binary, but automatically deciding that they are problematic in an attention-seeking way, even regardless of the level of lethality. And it just really diminishes, I think, and I don't know, some type of reductionist way of viewing a client.
Yeah, yeah. Are you talking in specific about like teenager parts? That a lot of clinicians don't seem to like teenager parts. A lot of clinicians don't like teenagers. I don't know why I like them myself, but
Oh, I mean, I love their spiciness. I love my
yeah,
own teenager parts and their spiciness. I was thinking about the the parts that might have roles that lead into self-injury and harm and behaviors that are really risky and difficult to keep a client safe.
yeah,
Whereas I hear a lot of clinicians sometimes in different spaces relegating that to attention-seeking behavior or resistance to heal behavior.
yeah, yeah,
They treat it as if it's almost purposeful in a way.
yeah, yeah. Or like this sort of attention seeking through masochism.
Yes.
Yeah, yeah,
And I
yeah,
think when you were talking about like that really the brutal injury that people have suffered multiple times and how horrible it is and the connection to the sadness. Like if people can think about that before they're labeling clients as resistant or attention seeking or just, sometimes people seem like someone is in their life just to purposefully make their lives miserable, and that is absolutely not the case. But it comes across to your clients, right? If you have that attitude and it's
They pick it up. I mean, it's a really, we talk about countertransference, but well, I think that's just basically our feelings that come up as therapists. But
right.
these are cases where the therapists aren't, I mean, and then it becomes somehow considered okay, but it's the therapist's lack, right? The therapist feels overwhelmed, so they're saying the client's attention seeking. The therapist is disgusted. The therapist is maybe burned out, or the therapist is maybe because they have a model and they don't know how to be more flexible to be curious about the client, and they say that the client's resistant instead of actually like looking at, okay, I'm trying, instead of actually looking how they're communicating and what things that they're trying and what might not actually fit. I think there's a lot of, and the medical field does this too, I'm sure, because I know you work with eating disorders. Like they start to, like, anytime the doctor can't do it, it
Mm.
becomes the patient's fault.
Yes.
Uh, yeah,
Yes.
yeah.
I always have the enthusiastic, like, whenever I hear that put out there, because I'm also somebody that has late stage Lyme disease. So it comes with a lot of physical ramifications that doctors can't always figure out. And I think whenever you have something that is chronic, can't be easily fixed,
Hmm.
it, it's exactly what you're saying. It's your fault, and people stop taking your calls and stop answering your questions because they, I guess, don't know, but they don't actually help you find somebody that might know.
Yeah, yeah. And then if you get mad about it, then you get the BPD on your like,
You're not allowed to have feelings.
right. Yeah, you're not allowed to be mad and reactive to their dismissiveness and their condescension and their abuse. Yeah.
Yeah. It's, I really appreciate this conversation because I know that we're probably ruffling feathers, right? Because there are people who listen to it and they get really activated by it because they're like, I don't do that. That's not me. That's not everybody. So like
Mhm.
we know it's not everybody. And if it's not,
Right.
if you're listening and you're saying, "Oh, this makes me so angry because it's not me," then we're not actually talking to you. It's okay to just know that it exists.
Yeah, yeah. Yeah, and it's always good to kind of self-examine. I mean, I do it all the time. I do a lot of my, own consultation. I think it becomes really dangerous when you're a therapist and you really feel solid in what you know what you're doing all of the time. And like, so I'm thinking if you are really rigid and feeling like you don't do any of this, maybe you feel a little too comfortable in knowing what you're doing all of the time and you're not self-examining and just gonna, if you're too secure, maybe there's something wrong.
It's a great point.
Yeah.
Well, how do we grow, right, as clinicians if we're not self-examining or going to consultation, supervision, and having somebody who can look at the ways in which we might be working with clients and thinking about situations and thinking about our own roles and how we're interacting on relational levels
Hmm.
and making sure that the work is relational and not transactional,
Right.
which is
Yeah.
an interesting concept I know for some folks who I think might have been trained in a more transactional way.
Yeah. Yeah. I know when I was a supervisor in community mental health, I had to kind of work with some of the clinicians who came to me to learn, who were like all about like kind of CBT and DBT and the worksheets. And you just like, they would come to me with the worksheet and I'd be like, oh, I mean, I didn't say honey, but in my brain, oh, honey. And we just put that over here. 'Cause, you can't go down and check all the, I mean, there are programs like with some of the early psychosis programs that I used to take their clients after they were done, and they would check all the boxes and they go through the program, and I mean, usually they didn't have psychosis, they had undiagnosed DID because they're all super compliant, right? Still had
Right.
DID, nobody, had treated it, but they were a success and they got their graduation cap and their gown. And
Mm.
so you can check all the boxes and still not actually feel better.
Oh, which is so sad, right? When you go through all the work and you're still suffering.
Yeah, yeah. Well, I mean, we've done that, right? Like, I mean, with DID and gone to different therapists and tried. I mean, I know I figured out I had DID and made the mistake of being like, my therapist will be so excited that I figured out we can collaborate on it and I'll feel better. And it was not that, it was not that way.
It didn't go that way.
No.
Oh gosh. There are some treatment horror stories for sure. Literally, I have shared many times with people. So I was originally diagnosed, it was in the early 90s. So it was MPD back then.
Right.
But it was also when the False Memory Syndrome Foundation was like this looming, large, and very active. So literally, it was, you definitely have MPD. Just try to do your best. You'll probably be in and out of hospitals your entire life. Nobody's going to treat you.
Uh-huh.
It was kind of like, well, why? Because I'm not sure that I'm going to be able to figure this out by myself, right?
Right.
And it was because people were losing their licenses.
Yeah, they were really vicious about that, and people were scared. Yeah, and then of course made its way into the textbook saying this is very rare and barely anybody has it, and it might not even exist. And yeah, yeah, I don't know. I know the Garden System put out. I think pretty sure it was the Garden System that the rewriting of DID to DID from MPD was actually because the person wanted to get rid of DID in the DSM altogether, but they wouldn't let him, so he tried to make it harder to diagnose people
Good grief.
with by I mean I know the criteria has changed since then, but that was the specific changing the name from MPD to DID, which I didn't know. But
I'm so disturbed by that entire era because having essentially a privileged white male found an organization specifically to target people who have been horrifically abused and gaslight them and then ensure that they don't get care or healing or in any way affirmed in a way that could be healing by going after the very people that could do that work for them is
I,
so particularly abhorrent.
yeah, yeah, I don't know why they feel so. I mean, I guess again, like it's that it scares them to think about having multiple consciousness, but there's just so much attack on it rather than just looking at the research that it, I mean, and just looking at treatment outcomes that it goes better when you actually work with the dissociation. I mean, even with psychosis, like when I work with psychosis, um, if we can calm some of the anxiety and the panic down, oftentimes I can work with the voice hearing the same way I do with DID, and it helps instead of just we just got to throw medications at this person and keep them quiet and keep them stable. There's no real treatment help. Can't really do much. Um,
That's so depressing, right?
yeah.
It goes back to like, I'm going to make you look normal, whether you feel good or you don't feel good. And it's sad and like anger inciting to know that people are being deprived of humanistic care.
Yeah, yeah. I suddenly flashed on was it Beck who made CBT? Is that right?
Yeah,
Watching an interview with him where he was just like his whole approach with like psychosis, and I'm sure with things like DID would be like just don't talk about it, and if you don't talk about it outward and you don't show it outward, then you're fine and you look good, and trying to train clinicians to not talk to them about like the stuff that's going on inside because then it might pop out again and they might look abnormal. And um yeah, I remember working very hard with some of my clinicians that I was supervising at a community mental health practice to like do a dissociation affirmative model with groups and things like that to work with being doing a hearing voices group so there'd be less shame around that, and then like some just different creative arts modalities that would be more useful for processing dissociation, because even if you have psychosis, I mean, everybody was kind of mixed together. You still have dissociation, and then having them watch something from an interview from him, and kind of like having to field these questions that I didn't expect because I didn't look at the content before I had them attend class. It was just available anyway. Like they're like, because they were already afraid to talk to the clients' voices in the program, and I was like, no, you do acknowledge them because they're there and they exist, like wherever they come from. Not ignoring them isn't gonna make them any better. It just makes them more scared of it because now they
uh,
feel more shame. Now there's nobody talking about it, but then he's like coming on saying, "No, don't talk to any of the voices."
it's still, oh gosh, it's still kind of everywhere in the field in a way. I mean, I get people who do the work every day all the time and maybe practicing appropriately and talking to parts and voices and various different presentations and clients, but there are people that are still really rabidly adhering to the don't engage
Mm-hmm.
conceptualization of it. Like your parts are not, people's parts are not going to go away just because you're not talking to them.
Right, right. And there's not one part that's the more real part, and all the other parts
Yeah.
are fake parts that just happen to be there. I mean, that would be that's that's a wild thought when you really boil it down.
Yeah.
But I think you really some people really think that way, like there's one real part.
Yeah. And there's also that assumption, right? If the person is good at masking and they appear to be the same to you, that many clinicians kind of stumble into that thought process of, oh, you then must be the quote unquote main part in the system, not realizing that they've actually spoken to maybe 10 different parts and just haven't recognized it or known it.
Right, right. Yeah, because some of them are like really, I mean, I work that way. We have like a lot of fragmented parts, so you're not necessarily going to see dramatic. I mean, we never really worked with big sweeping switches. I do work with people that have, but we just don't. And so a lot of clinicians just couldn't track it or see it.
Yeah.
Um, yeah, yeah. Conversely, I don't know. I've also had people I've talked with whose therapist main goal was to do fusion, like that was the sign of health, whether anything else was better in their life or not. And a lot of the parts just scattered and pretended they fused so
Oh,
that they could perform it for the client, the clinician. So then the clinician would be like, I'm successful clinician. And then the client could say, yeah, you're the greatest. And then later the cells would come out of the corners and be mad to damage.
oh, I could see that happening. It's
Yeah.
clients need to be able to decide what their own treatment goals are.
Yeah. Yeah.
And even then, sometimes I think we don't necessarily always get what we want because sometimes our systems just do what our systems do. Some fuse when you don't want them to, and some don't fuse when you do want them to. And our systems are designed, I think, to get us through lives as best as we can get through life. And they're going to
Mhm.
continue to do that.
Yeah. Yeah. They have their own decisions about how to do it. And sometimes fusion
Yeah.
can be helpful for a couple parts or two parts, and sometimes it can be traumatic. Like it doesn't feel good. I don't know that like we have enough discussions around what happens as clinicians when a fusion between two parts or a couple parts happen and it doesn't feel good.
And there's all different types of reactions that a client goes through, whether it's grief, anger, all kinds of things.
Yeah, yeah. And I have heard some clinicians sort of have this almost condescending viewpoint of like, well, but they're still there and it's the same thing and now you're just together and you kind of like you just need to get over it. This is normal. Like your feelings are silly. I mean, they wouldn't probably say that if I, but that's the tone that comes across. I'm sure you've kind
Yeah.
of heard that. Yeah. And and that goes back to like that sort of hidden sort of agenda and treatment plan. I mean, sometimes it's not so hidden with some clinical programs when clients go in those programs and there's sort of an institutionalization that
Yep.
they lock down, like you have to get with the program or you're not going to get better. We get to decide your diagnosis, whether you agree with it or not. We get to, decide the program. And sometimes it's like with some of the programs, they say they have some DID expertise, but they don't. And they're just like, we're just gonna do whatever. And if you don't go along with it, you're bad. Um,
It's going back into that box, right? Got to make you look
yeah.
like everybody else. And if you have a reaction to getting to a place where maybe you do look quote unquote more like everybody else, then that's your overreaction as opposed to just affirming people's experiences. So why are we trying to make oh, we already talked about this, I know, but my brain still goes back to like, why do we have to make everybody look the same? It's such an ableist view in a way.
It is, and it it really taps us out and it exhausts us. I mean, you I don't know how much you know about autistic burnout, like how when people are high maskers, not always, that's not the only, but like they can look like they're not autistic and cover it and cover and cover it up, and then at a certain point, it just everything just it's not like work burnout. It's not like, oh, I've been doing the job and I need a month or like a couple weeks vacation if you can get that in our you know, it's like things just, you can't make a sandwich sometimes. You can't uh, think, you can't get out of bed. And forcing yourself to be more social doesn't help. It just makes the burnout worse because you're then doing more masking. You're not just, it's like an inflammation of the nervous system
Oh, wow, that makes sense.
rather than, yeah, than just like I'm depressed. Though it can look like depression. And I think stuff with DID does that too. I mean, we've seen that where people mask and mask and mask and mask and mask a singlet. And at a certain point, usually around middle age or something like that, right? It just breaks.
Yeah.
It's too hard and it doesn't, it just, we can't do it forever.
It's a different way of thinking of it. And I think it's so important because I can envision where a lot of clinicians might not recognize it and sort of see it as, um, where it's you just need more sunshine and take your Prozac and go outside and be more social when really, if your entire nervous system is inflamed and needs a reset and your vagus nerve is tapped out, being social is not going to fix that.
Yeah, I mean, being more authentic, getting a reset and being able to do less, but our society isn't built for that. We're just kind of built to kind of burn people out, I think, at least in American society, oftentimes.
Grind culture seems to be that way. Yes,
We so reify like people who work 12 hours as if it's like heroic rather than damaging. Um,
it's damaging.
yeah.
Right. It's,
Yeah, it's not healthy and it's but you know what helps is right being able to have more spaces where you don't have to pretend you're single and you don't have to keep it together. And if we could have a culture that just accepted that people who are multiple exist and then people could just be multiple out in the world, it probably people would function. It would there'd be a lot less suicidality. There'd be a lot less like depression, maybe self-harm, because there's so many of us. I mean,
yep.
statistically, and the fact that we all have to walk around and pretend that we don't exist, and people even criticize us for making social media where people are switching as if it's going to catch on to other people rather than we're just out in the wild being ourselves. I would love, I mean, that's why I don't mind people who fake DID. I mean, obviously they need some support if they don't have it in their, but I really want it to be boring. I want it to be as unexciting as people think of as depression or
Yeah.
anything else that we have a DSM label for, where we don't have to prove ourselves and people don't want to look at us like someone who's in a zoo, and it's just the way it is.
I would say media has not helped that at all. I
No,
mean, we have so much shame attached to pretty much I think, any DSM diagnosis. If you're overtly experiencing a symptom and there are other people around, it seems like the automatic reaction is shame. It can be a panic attack in front of somebody else, switching in front of somebody else. Like we just don't have a society that's very open.
no.
And yet
Yeah.
we all deal with something, which is kind of ironic that we're not open.
Yeah, we don't reward vulnerability and we don't really reward like communal support or help. We reward narcissism and sociopathy, unfortunately. Um,
Um, First, I have a question because I'm curious how you would answer it. I've definitely heard people say, well, if somebody who's plural is going to be openly plural, as you should be able to be,
mhm.
what would that look like and how would that be manageable by friends? Because I've heard people say, so I expected to keep track of everybody's different parts, names and ages and likes and preferences? Because that seems like a lot of pressure. That seems like too much. Am I
I-
supposed to track that as a friend?
I'm laughing because it's like, I don't know, I'm in my head, and I know this isn't the kindest thing, but I'm kind of like, wah, wah, wah. But I mean, like, so then we should mask and like not be authentic because it's harder for them. Like autistic people should mask autism because what different styles are stimming is like or maybe lack of eye contact, which not everybody is uncomfortable for them. Um, I think I believe that people are sturdier than that and can adapt.
Oh, I love that answer. Because it actually you literally very graciously just threw back the most strengths-based view of the other people who are struggling to conceptualize what this could look like. Right when they're saying, "Oh my God, I have to track like 32 people and their preferences, and so when this person ghosts me, then I have to remember that it's their system member blah 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 who is going to be doing that, and that's a lot." And you're like, "Actually, you're capable of doing that."
Yeah, I do believe that, yeah, that I do believe that people can in relationship. And then they'll have a stronger and more authentic relationship with probably a lot more people. And of course, it's not like everybody has to track everything perfectly and people get mad. I mean, most of us don't expect people to track anything with us at all. But asking authentic questions or checking things out with curiosity or, just like we do generally when we're trying to see if we made a mistake or if we're trying
Mhm.
to understand something more, those kinds of questions would be more out in the open, and I think that would work better.
Yeah. When you have clients who are thinking about letting people know about their plurality and are interested in being in a more, sort of real, authentic relationship where they want their friends to know a little bit more about their system and their parts, including their traits and characteristics and names,
Mhm.
do you have or do you give them any type of guidance or advice around just trying to think of how I want to say this. I guess safety, right? Because there can be people who learn that they can call out parts of you if they have, you know what I mean? Like if they have your name, that part's name, especially younger parts. And then that kind of puts the system at risk. And hopefully most people don't do that, but
People, there are bad actors who do, whether they're have a specific agenda or whether they're just controlling. Yeah, I mean, I don't tend to want to have people just like go out there unless they have some comfort with their own system. And generally try to have people have system friends a little bit first, and that could still be
yeah,
tricky with all those things, but at least it's easier and some kind of internal, because I was going to say adult control, but like sometimes kids can do that function or just do protector stuff, like look out for each other so that doesn't happen, especially if they've got a groomed system, and it's sometimes called like organized abuse.
yeah,
Know a little bit that that's what's going on, which actually, if they get into therapy and they start to know that that's what's going on, it makes it harder for somebody to come along and do that. Whereas if they don't even know that they're plural, then they're much more of a sitting duck for that kind of manipulation.
yeah.
But to know what, kind of just talk through what it can look like if somebody's, and then pulling somebody out. And it's a tricky thing. Like you can't always people want to be out to their partners, and I think it's good to be out to their partners, and then you can't always tell with family or partners or people if they're gonna abuse that, and I guess you kind of have to unfortunately go with that when it happens and try to stop it because it is, yeah.
That's hard. I mean, that's a painful thing too, if your partner starts sort of poking fun at parts of your system, for
Mhm.
example, or calling them out for more entertainment purposes.
Mhm.
It feels really like a violation and disrespectful.
Yeah, it is a violation and disrespectful.
Yeah.
Yeah.
But you're right. I mean, you can't always predict that that's the way it's going to go until it actually happens and then,
Yeah.
sort of dealing with it then.
Yeah, I mean, I think if there were more spaces for people to be out safely and talk about it, then that would give more space for people to learn how organically, just without just their therapist being involved, but more, just to learn how to protect themselves more. It's a double-edged sword. I don't have a good, easy answer for that because I don't think that there is a good, easy answer for that.
Probably isn't one. I wish there was because that would make lots of people's lives easier, but it also wouldn't hold the complexity of humans if there was an easy answer.
Right.
Do you have favorite resources that you point your clients to when they're plural, looking for support regardless of where they're at in their journey, whether they're new or they've known about their system for decades?
It depends, yeah, different things. I do point folks towards the plural association if they're newer, especially, but even just because it tends than some other groups that I've run into to be more welcoming and friendly and more conscious about navigating dynamics in there. And I like that where I've seen other groups get kind of mean and abusive and hierarchical. And so I really want to know the group as much as I can to at least make sure they have safeties in place to keep things okay. I know that they don't talk about trauma as much in that setting, and that's on purpose so that people can just get comfortable with expressing their selves and not trigger each other and things like that. But I know that that's hard for some people, and also because they're not trying to diagnose or gatekeep. Some people I know don't like that they have accepting of all and any plurals and don't kind of weed out. I think that would create again more like a fascistic structure where you like how do you check, and why should you?
Yeah. Oh, I was thinking about that the other day, actually. It was a social media thread where there was somebody, it was like that sort of like let's sort people into categories, and this category is authentic somehow, and then this category is somehow not. And all I could think of was, you how do you know what somebody else's experience is?
Yeah,
Like you can't know that unless you're that person. And on the one hand, you can't say, oh, believe all people, and then say believe all people, but only in this category.
yeah, definitely. And I think like the concept of the difference between traumagenic and endogenous, like people like to separate. I mean, I think it's kind of a false dichotomy when you really boil it down, because our world is traumatic. Like,
Hmm. Yeah.
then we get divided into like this is the correct trauma to have DID and this is not. And I mean, even Vedat Sar said people can have DID that he's encountered that don't have sexual abuse or physical abuse, but have a distant emotionally distant parent who has some level of dissociation. And that I think Krista Kruger was also on that as well. Um, and a lot, I mean, you've seen all of the papers. I mean, all, but like that's kind of a that's too many, too wide. But a lot of the establishment says you have to have high hypnotizability and that's passed down through some kind of genetic component because not everybody can have DID, even if they have all of the early ongoing trauma. Not, and you've seen this. I've seen this in my
Yep.
practice. Not everybody does.
Yeah,
So
for sure.
uh, there's got to be some natural, like some people have a brain that can kind of go that way, and some people have a brain that doesn't. It's different ways to manage. I like to call it just like impacts.
Mhm. Yeah.
And then, yeah.
I think it might have been my own therapist actually. Somebody was telling me about a research study that I think she had read that talked about like attachment issues prior to the age of 2. Like if, your attachments are really disorganized or insecure prior to the age of 2, you have a much higher probability of developing DID than which kind of makes sense.
Hmm. Yeah. And of course, the ID in and of itself is defined as having to have had some kind of trauma in and of itself, um, which makes endogenous not, I don't know. Anyway, uh,
Well, but if you're labeling like the type of trauma, right, like attachment trauma.
right.
And so I wonder how many endogenous systems who don't think that they've had trauma have maybe had something prior to the age of 2 that they simply don't remember that predisposed them to this type of plurality. And they're not Ramcoa survivors. They don't have daily physical, sexual, etc. abuse, but who
Yeah.
knows? I don't know.
Yeah. I do think that that's possible. I mean, I also think that if somebody's maybe slightly wired to be like this, maybe they would just have like a smaller system, and then if you get more impacts, then things might split more. Um, because because we have a lot of cultures that recognize plurality as part of. how they view the human body mind. And so it's uh and even the DSM says that. So then that would be an endogenous plural, although I'm sure that there's trauma. I mean, we obviously know there's trauma in all sorts of different.
I'm not sure there's a human on the planet who hasn't had some kind of trauma.
But if there's a recognition of this is how this culture views the psyche, why is that semi-valid, but not entirely valid? And then this other thing, I think it's like a Western colonialist, like it, there's those people over there and they have this experience. And we sort of nod to it, but we don't really believe in it. But we'll just
Mm.
like tick the box that it's okay. And then we'll say this is actually this real thing because we've studies on it. But I think it's messier. That's why I say like the split isn't really because it's messier than that. I mean I guess that's why I look at a lot of things is a lot of things are messier.
Well, you're also somebody who's, I think, really, really good at seeing the nuance and respecting the nuance in many different situations and many different people. You don't seem to have ever been anybody that's going to categorize, to put something in a neat box. You're like, what's in front of you is what's in front of you.
Yeah, yeah. I mean I like to study the categories, but then I don't like actually believe in them entirely.
Yeah, which is kind of freeing,
Yeah.
you know, and I don't know what the word is. It's painful. That's what the word is. It's painful sometimes to see the places in which we're pitted against each other when really we could be a much more powerful collective whole. Like if we're busy affirming each other and saying, you're telling me this is your experience. I believe you. Why do I need to go and verify it?
Yeah.
You've been living this way for decades. It's your experience, and it might look different than mine, and your history might look different than mine, and it's still valid.
Hmm.
Yeah. Imagine the peace there might be.
Yeah.
Like,
We wouldn't have all of these people trying to prove other people that they're incorrect because they want to simply because they want to be right.
yeah, yeah.
Yeah.
And I'm not sure what you get from being right.
No.
Like, what's the end? What's the goal? Like, isn't the ultimate goal to support people in building lives that they feel good in?
Hopefully. But I mean, there was a study in the 70s that studied therapists. Of course, the therapy map is much different than it was in 70s, probably more middle class white men, but said that showed that there was a higher degree of Machiavellianism in the therapy field than other fields. I don't know all the fields that they have to come back into, but I think there is for many people a satisfaction in being right, getting the trophy, getting the certificate of I am the best. And I know sometimes I get accused of that. I think it's because I am autistic. I learned I just speak very directly and clearly. And if I know something, don't dumb it down. But if assigned female at birth, people are supposed to, and then you get you get if you speak with confidence, and you might experience this, then you get told that you want to be right and you're trying to control everybody when like I'm perfectly fine with somebody else come up with something else that's different than me. But I think a lot of therapists don't are brittle around that.
Yeah. Oh gosh, to be assigned female at birth and be a direct, smart speaker can be problematic in the world.
People make a lot of weird assumptions. Yeah.
Yeah. Yeah. Yes, they do. Yes, they do.
Yeah.
There is clearly a really, well, gosh, this is two questions, two parts, right? Part one is I've heard many people say that neurodivergence is anything that is different. So OCD, plurality, I can't think of anything else off the top of my head, but is neurodivergence in addition to autism spectrum quote disorders.
Yeah. Well, you are. I mean, it is true that neurodivergence is anything that deviates from what's called the neuronorm. So like, and there really isn't a normative brain. And if you have something that's close to it, you might, as you age, you may get a TBI, you might develop seizures, you might have a substance abuse issue, you might, all of those things change the brain and the body mind, the neural network, right? So there's the ideal. I I think of like, I just the Aryan. Nazi sort of like, we have the perfect brain, this
Gosh.
is the ideal brain, right? That's not real. And making people shove to that is painful and
Yeah.
racist and eugenicist. But there's a concept of that. And so anything that deviates from that and is the neurodivergence. And then when you have more than one of those things combining, that's either neurocomplexity or also it's called multiply neurodivergent. So, but I have noticed that there in the community, there's a very high self-report of autism. And I know some clinicians think that's because of the developmental trauma looking like autism, but there are tells to tell the difference. I mean, there are things that do look, and because people are autistic, have lots of trauma because the way the world responds to autistic people.
Oh gosh, yes.
Yeah, but there are differences that are not related to trauma or that look developmental or aren't related to dissociation that you can track in terms of like relational style in certain ways like for instance a lot of autistic people are tend to be direct speakers which doesn't often go over too well. Um, there's some other issues that overlap with common body structures like hypermobility or Ehlers-Danlos syndrome, which causes kids to walk on their toes, which is also marked to track kids who are autistic. So there are different. I mean, I made a chart for it at one point because I was kind of tired of trying to argue with people that no, there actually is autism and there really is ADHD, and there's trauma, and they look different, but they overlap and can look the same. And here's it. Yeah, here's how it all goes together. It wasn't a perfect chart, but it was the best that I could do. But I'd be really curious because it does look like there is a lot of autism in the DID community and ADHD, and nobody has studied that or looked at even just like the numbers, like tracked. It would be interesting. I wonder in because I've been curious because of the neuroplasticity and the lack of pruning with autism, if that somehow supports development of DID more. And that's just I like there's no science, but just it's a curiosity I have. More neural networks, more um, ways that people can hold information. I don't know.
Yeah. I'm so curious about it, honestly, because you can definitely see there are a lot of folks who are neurodiverse in the plural world for sure. I mean, who are autistic, I should say. Um, and I think about, I have a daughter who's autistic, and I think about the things that she does and it seems to experience or that she can, as best she can describe, that remind me a lot of some of the experience I have as a plural person, and I'm not autistic.
Mhm.
And it's interesting, like I can see the overlaps just between the two of us with her autism and my plurality.
Interesting.
Yeah, like her, I don't even know how I want to describe this, but watching her experience her own inner world
Hmm.
reminds me very much of places and how I experience my own.
Yeah, yeah.
Um, yeah, just some interesting things.
Yeah, you're talking about like the sort of the inner daydreaming. I mean, it's only they're often called maladaptive, but I think that gets put on prematurely.
Her, I'm going to call it ability. Like she has very clearly a vivid inner world that she can spend a lot of time in to the exclusion of the external world.
Yeah.
But in a slightly different way. But that was also something that I could do as a child with different parts of myself.
Mhm.
And it helps you survive when there's all kinds of shit going on in your life, right?
Yeah, yeah, no, I do think there's overlaps there. I mean, I think sometimes people mistake one for the other and there are differences,
Yep.
but I do think there's a thinner wall between the two than maybe people would like to admit. And I think that's also why, I mean, sometimes there's been criticism of autistic people thinking that they have DID and even thinking that they are transgender, right? When they're like, well, they're not, and they can't really figure this out for them. I mean, they can. I'm just
Yeah.
doing the voice of the critical people. They want to protect the people from the poor autistic person from making a mistake.
The assumptions.
Yeah, but really autistic people tend to, the research supports this, tend to think more about these things and don't get as impacted by the societal shaping that non-autistic people do, and so tend to recognize these things sooner in themselves than non-autistic people, just because of the curiosity and take, like, you know how kids who are autistic take things apart and line them up and then put
Yes.
them back together. So like same thing with like sociology and social shape and the brain and like gender and multiplicity, right? But yeah, I think there are overlaps that are true with the I mean, a lot of people self-soothe by going into that daydreaming when they're autistic and spend time to just decompress and be away from the external stimuli, and it's really helpful for some people to do.
It was always interesting to me that people who want to draw, especially kids with autism, out because, oh, they need to be connected to the outside world. It's so lonely. My kid is definitely not miserable when she's in her internal world.
Yeah, yeah, they're not doing it the way that I expect them to do, so let's like correct that, you know.
That's just painful to think about. And, you know, whether you're trying to quote correct plurality or trying to correct autism as opposed to really being able to tap into the internal
Hmm.
brilliance that each person really
Yeah,
has.
and accept people as they are and just like rather knock down the shame rather than pop it up. I do think, I mean, you know that the person who created conversion therapy is the same person who created ABA, applied behavioral therapy, to make, yeah. So yeah, it makes sense though when you think about it, but yeah, because the model, like we're just trying to shove people, if your boy wants to wear a dress, you gotta knock that out of you. If you like to stim, you got to knock that out of you. But I think we do that a lot with, I mean, I don't think it's as, the treatments have never been like brutal like that, or I don't know, maybe I'm sure that they have, but with
Yeah.
DID, but they're still like that, almost like leaning on shame to knock it out, knock the switching out, or knock the overtness out, or yeah.
Yeah. Yeah. I think back when we didn't do ABA for my daughter when she was little, we would, have you ever heard of the Sunrise program by any chance? There's a program out in Western Mass called the Option Institute and the Autism Treatment Center of America, and they developed something called the Sunrise program. And it was this set of parents, and they had a son. He had autism, and when he was little, they had said, "Oh, he has a 35 IQ, and you're going to have to put him in an institution." They developed a program that's a play-based program, and it was about entering his world. It was such a strengths-based program of really, they really teach you to watch your child in curiosity and awe and wonder, to make every opportunity to be an opportunity for joy and to learn how to experience joy the way that your child with autism does, as opposed to like spending time saying stop flapping or stop spinning. They're literally like, no,
Mm.
spin with them, not to imitate them, though. Like you're not imitating, it's to truly try to join on an emotional, felt sense level of what it is to experience that and to see if you can tap into the joy and or relief that they're experiencing. And it's the coolest program. They teach you to look, they use a traffic light system to enter into the experience with your kids. So they're like, when your child gives you green lights, you can then begin to enter into their world and have these experiences with them. If they're giving you a red light, then you stay observing with curiosity and love.
That's great. And I like that too. So you're not just intruding into their space, you're kind of looking for the cues. So
There's certain behaviors that are inviting and then certain behaviors that are like, setting up a boundary.
yeah, yeah, yeah. Yeah, that's excellent. Yeah.
Even conceptualizing what I think some people would label problematic behavior, right? Like screaming, dismantling a room, they label it as communication. So what is that person communicating in that moment? And they might be communicating a dysregulated nervous system. Okay,
Yeah,
so how do we help them regulate that?
I think that's great too, because I think that's definitely true. Or they're just blowing up, or they're too overstimulated, or there's something that's hit, the person in a bad way. And yeah, I know there's a place on the East Coast, the Judge Rotterdam Clinic, I believe.
Oh,
Yeah, and they still use to this day electric shock for those kinds of things. They're not thinking like you're just creating a trauma response so that if they think that they're going to do it, then they have to figure out a way to dissociate from themselves and shove everything way, way down. And possibly if they're split right into selves, if they do that, you can just think of all the body memories that would be created.
Mm.
Why don't you instead, like that clinic does, like figure out why they're
Yeah.
doing it and support them. If they're hitting their head, maybe the lights are too bright, their clothes are too scratchy, they I don't know, had too many people in their face.
Mhm.
Maybe they need to figure out a different system so
Yep.
they don't do that. Also, maybe some safety equipment so they don't hurt themselves.
Right.
I don't know.
It's such a different way of living in the world. And I kind of wish that it's so in alignment with a lot of stuff we've been talking about today, right? Where we're really honoring the differences in other people and then being curious about them and trying to enter the experience with to develop an understanding in a way that's deep and meaningful, not one that's judgmental because I'm trying to figure you out so that I can make you look like me. It's not about that.
Right. It can fix you, it can make you well or healthy, whatever that is too in our constantly traumagenic society.
Yes. Like, let me just help your experience be kinder and gentler.
It usually means like go to work and work an 8-hour day and until you can retire. And that
Mm.
is, I mean, that is
Can
like
we
what we
change
do
that?
healthy. Yeah. I mean,
No, 8 to 16 hour days sometimes, right? And then
right,
when do
right.
you get to live your life? I don't know. This has been amazing. Like I really love the spaces that we've kind of dipped into.
Yeah, me too. It's been a fun conversation.
I can't like truly can't thank you enough. I'm curious of two things, if you don't mind leaving us with two thoughts. One, I'm curious about what area right now you're kind of most interested in. Like, do you have anything new that lights you up that you're investigating or working with that's just different for you?
Hmm. Well, I'm trying to write, I mean, I'm contracted to write a book, so I'm trying to make myself
So
do
it's
that.
gonna happen.
And I was excited and I still am. I mean, most of the stuff is like, but I've been really running into my executive functioning. So I don't know that I am excited to do the DID and autism like together book. I hope
Awesome.
to do that. But I'm also like that like self-perfection and like just sort of yeah, trying to get myself to do that. But that's just I'll get it. I will get it done. I think the things that I've been really diving into are how to help people with different kinds of groomed systems.
Nice.
So because it's become most of my practice, it's not that I advertised for it, it's not that I saw anybody out, it just landed there, and being able to track it and being able to help other clinicians in consultation track it.
Yeah.
With a more like wide lens, because some people like go really rigid with it and go to a specific religious lens or something like that. It's really a complicated, like multifaceted thing, but has made a big difference because some clinicians who are really, really big clinicians, I'm so surprised. Like sometimes I've had people who've spent a lot of time consulting with them with this client, and then they have consulted with me. Um, and it's so clear like that there's a groomed system going on and that's just shifted everything in the work
Oh, wow.
because uh it's a different yeah it's a different way to work with a system and also just seeing them and seeing it just opens the stuff up really fast,
Yeah.
maybe faster than sometimes I try to slow it down, of course I'm not trying to, but it opens up a lot of things that people have been stuck with the work with and haven't been able to make progress, and they're like, why do I keep hitting on this wall? And then you're like, well, because there's actually an actual wall in there, and it's yeah.
I'm really glad you're doing that work. I know I've consulted with you on a client and it would completely change the trajectory of the work in a really positive way. So
Yeah,
I enthusiastically recommend you as a consultant
it's appreciated.
frequently. Last question for you. It might be a two-parter, or it might be a blanket for you. I'm not sure, but what would you most like to leave folks who are plural with and the providers who treat them? It can be a sentiment, words of hope, encouragement, caution, could be anything.
I think it might just be echoing a lot of the things that we've been saying, that that being plural is just a different way of being and walking in the world, and should be honored and respected. And in doing clinical work with plural people, separating the trauma from the plurality in a way. So like, because I think we enmesh them too much. So we think that the plurality is a manifestation of trauma. And sometimes it kind of is, but if we're really going for a strengths-based model, which we say we are, then the separation or the deviations are the coping, right? The way to, the natural way to manage it. Like when like a tree, like an oak tree or a redwood tree, gets hit by lightning, it might split and then make two trees, but that's not a, it's not broken, it's not damaged. It's just, that's how nature, that's how it's built to interact with nature. And so we want to really focus on taking down the flashbacks, the nightmares, the panic attacks, the lonely selves that are stuck in loops.
Mm.
Not so much fixing that they exist, that's not something to be fixed.
That is the best message ever. Yeah. Oh, I can't thank you enough for sharing yourself, your wisdom, everything about you. I just have so much respect and just think so highly of you.
Thanks, likewise. I'm actually looking forward to consulting with you on some work too.
Thank you. Oh, Katie, I can't thank you enough for joining us today and bringing your full, brilliant plural self into this conversation. Honestly, for those listening, weren't they wonderful? Like their words remind us so much of what's possible when care is curious, collaborative, and rooted in lived experience. That is not a diss for people who don't have lived experience, but there's so much we can learn. Like Katie really showed us how system affirming work isn't just a clinical concept. It's a relational practice, it's a political act, and it's a deep form of witnessing. It's so important for us to not only recognize differences and to quote, allow differences, but to celebrate them. When we lean in with curiosity and love and compassion, whether you are a system yourself, whether you're a supporter of a system, or whether you're a clinician, lean in with that loving curiosity and allow people to be who they really are and welcome them in their full self. It's just transformative as you journey through together. So, whether you're a system, a supporter, or provider, really hope that you found something valuable in today's conversation. And if you did, please share it with somebody who needs it. And don't forget to subscribe to our Substack so you never miss an episode or an article. Until next time, let's keep healing. Thank you for tuning in. You can find our blog on Substack at healingmyparts.substack.com and on Instagram at healingmyparts. Just a disclaimer, any information shared in this podcast is not a substitute for professional therapy or behavioral health care. Nor does listening to the podcast constitute a therapist-client relationship. Please be sure to take extra good care of you. And until next time, keep healing and thriving.